So, how do you know if you have this split ab called diastasis recti? I'm Dr. Wendy Troney, physical therapist, and I've been taking care of women for 17 years, and I am currently actually doing research on this. And let me tell you, how do you know if you have this? It is not just that your belly looks fat, wrinkly, yucky. What it is a separation of the six pack muscles, and there is a gap, and the gap is either 2 fingers wide. That's the way they talk about measuring it. But it's not just that, it is also the depth and how it separates. The linea alba is a white piece of connective tissue that binds those abs together. And when you were pregnant, the integrity of that little linea alba was destroyed. And so, if you've had twins, if you've had two or more kids, like up at the farm, you have this. And then those muscles separate and greater than a 2 finger gap right here. If you want to try to assess this yourself, I have a video on my page, but you're going to be on the ground. You're going to take your fingers and you're going to feel between those two bellies of your rectus abdominis, which is your six pack. And you're going to see if it fits between. Now, it's not only just the gap width, it's the depth of the ocean. Another thing you can look at is, do you have doming, which means like it looks like an alien is coming out of your belly, or do you have what's called invagination? So like you go to sit up, but the two sides of the muscles, the rectus abdominis, like open, and then you see like a valley down into your abdomen. You're like, I should not be able to see down into my abdomen. Doming is much more common. If you do have this, I believe in doing lovely corrective exercises such as pelvic floor, transversus abdominis, eventually progress to a modified curl up, incorporating breath. I believe in bracing. I believe in kinesio tape. I do not believe in e-stim for this. If you see me in clinic, I absolutely do dry needling for this. I dry needle the obliques. I dry needle the rectus abdominis. I do think a majority of women have this. Sometimes it spontaneously heals, but a lot of times it doesn't. I hope this helps, and I want you to hit the plus sign for more information, ladies. Hope you have a good day.